I grew up in Atlanta, and in Atlanta I was always interested in the church. As a teenager, I read the Bible, came to realize that a third of the Bible has to do with healing the sick. It's on every page. But I would look around to see what churches did, and there just wasn't much to it. All over this country, we had built large hospitals that have church names on them. They do good work, but they had almost nothing to do with worshiping congregations. It seemed to me that there ought to be more to it than that. So I set out in my own life to figure out how to connect faith and health, medicine and ministry, and then set out to create a ministry that ultimately became Church Health. We do medical care, dental care, eye care, counseling. We have a large nutrition center. Everything that ultimately is what health is all about, and it's not just about the absence of disease. There are over 80,000 people in Memphis who depend on Church Health for their health care, and we have 1,000 physicians who volunteer with us. We've been connected to the Memphis Medical Society since 1987. I was led to the Memphis Medical Society saying, hey, this is an organization that would want to help make Church Health succeed. And from day one, that has been my experience. Back in 1991, with the partnership, the Memphis Medical Society, we created something called the Memphis Plan. This is a way for us to have people who make less than 200% of the poverty level to be enrolled in a program where the doctors from soup to nuts donate their time. It costs $50 a month. It's an employer-based program. We're able to care for thousands of people in Memphis because the Memphis Medical Society has made this happen. We ultimately passed a state law. It's called the Memphis Plan Act of 1991 that allows this work to be done in the state of Tennessee, and it's all driven by the commitment of the Medical Society. Project Access has now become something where Church Health and Memphis Medical Society are intimately working together, hand in glove. The employees of the Medical Society working on Project Access are now embedded in Church Health. We're going to allow for many, many more people to be cared for and for physicians to be able to donate their time to care for our neighbors. What I now know deep down in my bones, if you care about Memphis, Memphis will care about you. There are very few communities that I think you can say that. For the work that I have done for almost 40 years, knowing that the physicians in Memphis not just are honoring me, but are honoring the work of Church Health. It's not just built around me. And I feel like we are fully embedded in Memphis and embedded in the Memphis Medical Society. If you want to make a difference in Memphis, you will be given the opportunity and you'll find other people who will come alongside you, just as what's happened with Church Health and the Memphis Medical Society over the last 40 years. The idea of providing health care for people who have nowhere else to turn, that's what we are all called to do. The giving back, caring for other human beings, that is what I believe God has set before us. It ultimately is what makes our life meaningful.